Hi everyone. In this presentation, we're going to be talking about string floss and water flossers. This presentation is brought to you by Steve Peterson, Nicole Jeffrey, Zen Yang, and Sandra Chen.
Let's start off with talking a little bit about interdental cleaning. The use of an interdental cleaning device is beneficial because it helps to reduce the amount of plaque biofilm located between the teeth, which can help to reduce inflammation and bleeding caused by the bacteria found there. Plaque biofilm accumulates quickly in the interdental spaces, and dental caries often develops first just under the contact, while gingivitis commonly develops first within the coal area, which is the saddle-like depression between the buccal and lingual aspects of your dental papilla. Toothbrushes, unfortunately, are unable to reach these crucial areas that are in need of daily cleaning to help prevent the progression of periodontal disease. And because of this, at the minimum, it is recommended to use an interdental cleaning device at least once per day.
String floss is used to remove plaque biofilm from the interdental spaces when there is type 1 embrasure space present. Type 1 is when there is tight contact between adjacent teeth and healthy dental papilla filling the space. C-shaped technique using the spool flossing method for adults or the loop flossing method for children. Advantages: string floss is most cost effective. It's able to remove plaque 2 to 3 millimeters below the gum line, and it's portable. Disadvantages: it has reduced efficacy with type 2 and type 3 embrasure spaces. It's most difficult and time consuming of all interdental cleaning aid options, and most patients do not use the device properly. There are many different types of string floss. Waxed floss slides easily between teeth and prevents breaking or fraying. Unwaxed is better for crowded teeth because it's thinner, however, it can break easier. Tape is good for teeth with larger embrasure spaces, such as type 2 and type 3. Tufted or braided, also known as superfloss, is regular floss with a larger tufted section that has built in threads at the tip. It is best used around dental prosthetics and appliances. Flavored floss is helpful for encouraging children to floss more often.
There are two flossing methods that we like to recommend to our patients. For most adults with good dexterity, we like to recommend the spool flossing method, which is done by first breaking off 12 to 18 inches of floss, usually equivalent to an arm's length. Starting at the ends, wrap the floss around both middle fingers, making sure that most of the floss is wrapped around the non dominant finger and just a few times around the dominant finger. Hold the floss taut by using either your index fingers or thumbs. Perform a gentle seesaw motion to pass the contact of the teeth. It is important to be gentle when first pushing the floss through to avoid trauma to the gum tissues. Then wrap the floss tightly in a C-shaped motion around the tooth, and perform 3 to 4 up and down strokes from the contact to just below the gum line. Then repeat the C-shaped motion on the other side of adjacent tooth. Use a new section of floss by unraveling from the non-dominant finger and wrap the used section around dominant finger. Then repeat for entire dentition. Another method we like to recommend is called the loop flossing method, which is suited for children or adults with poor muscular coordination or arthritis. This method is done by breaking off about 8 to 10 inches of floss and tying the two ends together into a knot. Using the same steps as mentioned in the spool flossing method, repeat steps 3 and 4 and rotate the loop to use a new section of floss. Repeat for entire dentition.
Floss threaders help clean in harder to reach places that prevent cleaning in between the teeth and into the gum line. You will break off 4 to 6 inches of floss and thread it through, overlapping the floss 1 to 2 inches and securing it with your fingers. Insert threader from the facial surface through an access point and through to the lingual side, then remove threader. Move the floss back and forth several times, then remove floss toward the facial surface and repeat as needed. An advantage is that it allows access under permanent dentures or retainers, behind orthodontic wires, and under pontics of bridgework and behind retainer bars. A disadvantage is that it is not ideal as a normal daily interdental cleaning device, especially between type 1 embrasure spaces.
Water flossers, or oral irrigators, are also helpful with the removal of plaque biofilm from the interdental spaces, regardless of the embrasure type that is present, especially for when patient dexterity is an issue, which is often common in the elder population. Water flossers also help to reduce the level of bacterial toxins found within the sulci. Proper use would be to follow along the gum line with the tip at a 90-degree angle to the teeth, pausing in each interdental space for approximately 5 seconds on all buccal and lingual surfaces for the entire dentition. It's also important to mention that some clinical studies have shown efficacy at as little as 3 seconds. Some advantages are that it is extremely easy to use, which helps with patient compliance. It has been shown to reduce pro inflammatory mediators within the gingiva. It also has shown to increase anti inflammatory mediators as well. So it can reduce interleukin 1 and 6, and it can also increase interleukin 10, which will help to fight off inflammation and reduce the problems that come with that, such as destruction of the periodontium. Other advantages are that it increases gingival resilience through gingival stimulation, kind of similar to what a rubber tip stimulator would do. And then it provides better plaque removal in pockets that are 4 millimeters or deeper. Some disadvantages is that it can be expensive for some patients. A really good option is Water Pick Aquarius, which has all of the features and can come in as cheap as $60 to $70, I believe. And then it has greatly reduced results if the device is non-pulsating or used at PSI settings that are below 6 to 8 PSI. 6 to 8 PSI is where the clinical efficacy has been demonstrated in trials. And the pulsating nature is what leads to the efficacy as well because of the hydrokinetic impact and flushing zones. And then the last disadvantage would be that it has the lowest portability of all interdental cleaning devices since it requires you to plug it in and you're not going to be carrying it around unless you get a portable version, but those have their limits as well, mainly due to water capacity and battery life.